When you are ready, use the retractor on the Mayo stand to expose the fascia surrounding the joint capsule. Select the scalpel from the Mayo stand to your left. This incision begins just above and medial to the patella. Patient's left ankle, preferably with your left hand. Perfect. Now move the ankle to position the knee into full extension. Grasp the lateral margin of the full incision, preferably with your right hand. Pull the incision margin laterally, opening the incision, dislocating the patella laterally across. Good. Now manipulate the leg to reposition the knee into 90 degrees of flexion. The first pin is installed 4 finger widths below the incision site. Grab the pin driver. For this simulation, the pin driver will have the necessary pin already loaded on the pin. Pull trigger to install the anchor pin and secure the tibial array to the anterior tibial cortex. Select the tibial target array already mounted to the universal 2-pin fixation block. Place it over the anchor pin you previously installed on the tibia. Grab the pin driver. Pull trigger to install the anchor pin and secure the tibial array to the anterior tibial cortex. Now select the femoral target array already mounted to the I-block femoral cutting guide robot fixation base. Place along the medial aspect of the distal femur. The fixation base clamp will help find the proper anchor placement. 2 anchor pins are required to anchor the fixation base. Grab the pin driver. Pull trigger to install the first anchor pin, securing the femoral array to the medial cortex of the distal femur. Pull trigger to install the second anchor pin. Grab the pin driver. Select the nanoblock. The nanoblock will guide the tibial resection. Position the nanoblock over the tibial tuberosity. The target array is 3 anchor pins are required to anchor the nanoblock. Grab the pin driver. Grab the bone saw to resect the tibial plateau. Place the blade into the resection guide on the nanoblock to resect the tibial plateau. The nanoblock can now be removed. Grab the pin driver to remove the anchor pins from pin. Remove the second anchor pin. Remove the final anchor pin. Grab the nanoblock. Return it to the Mayo stand. Select the balance bot. Install by inserting the robotic paddles into the joint space on the resected tibia. Grasp the ankle and manipulate the leg into full extension and back into roughly 90 degrees of flex. Maneuver the leg through a complete range of motion to get quantitative data on the knee. When complete data acquisition is achieved, return the knee to 90 degrees of flexion on the surgical table. Grab the balance bot. Return it to the Mayo stand. Grab the I-block. The I-block guides the femoral resection. Attach the I-block to the femoral fixation base near the femoral target array. Observe the I-block automatically adjust to create the distal cut. Grab the bone saw. Place the blade into the resection guide to make the distal cut. The I-block will now adjust trajectory. Now use the bone saw to make the anterior cut. Allow the eye block to adjust trajectory. Now make the posterior cut. The eye block is now ready for the anterior chamfer cut. You may now make the final posterior chamfer cut to complete the femoral resection. Grab the eye block and return it to the Mayo stand. Grab the tibial impactor and mallet from the Mayo stand in place. Now strike the impactor strike pad with the mallet to impact the tibial tray into the tibial plateau. Pick up the femoral shell. Approximately place the femoral shell onto the prepared distal femur. Grab the femoral impactor and mallet from the Mayo on the femoral shell and hold in place. Now strike the impactor strike pad with the mallet to seat the femoral shell on. Select the poly inlay. Insert the poly inlay into the tibial base. Now run the final range of motion test. Congratulations, you have earned the total knee badge.